Welcome to all. Now we are going to see the traumatic illness. One of the traumatic illness, tennis elbow. How I managed the case in homeopathically beautifully. I am going to explain that case. The name itself we can easily understand the disease condition. Those people who are played in tennis, they are prone to get the illness, strain in the region of lateral epicondyle, tear in the region of the tendon attached in the lateral epicondyle. Before going through the cases, we have to know about the pathology that involved in the region of lateral epicondyle. Here the muscles attached, the tendon attached in the lateral epicondyle getting strained, inflamed. So the inflammation in the tendon of the forearm muscles that attached in the lateral epicondyle, that is strained, some tear in that tendon region. That is called, we called medically lateral epicondylitis, the inflammation in the lateral epicondyle region. So in homeopathically, we should know about the pathology, because in the repertory we can easily find out that medical condition. Directly we can take the rubric, and also we should know about one other opposite traumatic illness, that is a medial epicondylitis, that is a golf elbow, that involved in medial epicondyle region. So we have to know about the pathology. To understand the pathology is very important, not only in allopathic side but also in homeopathic side. We can apply rubrically, we can easily apply. Okay. Now this case, within 1 month I have treated, but there is no success at all. Within 1 month of time interval, I have changed 3 drugs. So I am going to describe about how I succeeded in cases after the 1 month of failure. After 1 month of repeatedly changing the drug, there is no success at all. I retook the case. I have found these all the totality of symptom. First, the person went to allopathic side. They gave some steroid to get rid of pain, but there is no improvement at all. They suggest some operation. That's why I escaped from the treatment. He consulted me with the fear of operation. So I took the rubric of fear operation. The pain, it is intense, continuous suffering. Morning rising after it is pain is aggravated. Pressure gives some relief. The pain is a stitching type of pain. Stitching, pricking type of pain. Also slightest touch causes increasing pain. That is a major symptom I have noticed. From slightest touch, the pain is intensely aggravated. In mind side, he extremely anxiety about business. How can I able to do my job with injured hand? That is a major thing in this present mental state. And also he want to get right, free from the disease as soon as possible. He want to carry it fast. And also he feels the pain is continuously bothering, troubling. So that is intense anguish. He feels persecuted. So I took the rubric of delusion. He is persecuted. So these are the totality of symptom I got from the case. In the 1 month of gap, I have changed 3 drugs, Calcarecarb 30 and 200 in splitting dose. But the time to time relief, but there is no smooth recovery. And also I change lycopodium 0/1 and Rastax 30. Rastax 30 it is some partial relief. Whenever the repetition happen, it is some partial relief, but if there is no the pain again it is started worsening. So I just work out the case. So here I work out the case which are all the sure symptom. That is a confirmed symptom, confirmed picture. Here the confirmed picture symptom is the pathology involved in the tennis region. It is a tennis elbow, the pain, the inflammation in the lateral epicondyl region. That is a confirmed symptom. In the 1 month of gap, he repeatedly telling the symptom of slightest touch causes aggravation. That is, I took it as a PQRS, slightest touch aggravating. The nature of pain is stitching, pricking pain. So here I took only solid sure symptom from 1 month of interval. That is, I took the affinity, that is elbow, tennis elbow. Then I took the PQRS, slightest touch aggravating, and then the sensation involved in the part, that is stitching pain. So after taking a 3 symptom, I just put it into the repertory. In repertory, many people doesn't know about the pathology. Pathological rubric, we can take the pathological rubric. In tennis elbow, we can take a direct rubric. The extremities, inflammation upper limb elbow condyle around tennis elbow. That's why I'm telling we should know the pathology involved in the part. So I took the rubric and then I took the pain is stitching, generality pain stitching, and then I took the rubric of general slightest touch aggravating. So after repertorizing the 3 rubric, I got 4 remedy. If I just eliminate the rubric, that is sure symptom. So after eliminating the 3 confirmed rubric, I get the remedy China Rastrax ruta silica. So now how to finalize the remedy? Now I confirm the 3 rubric and just eliminated. I got 4 remedy. After that, after that, we have to finalize the mental picture. So not only the pathology and affinities finalize the drug, we have to finalize with mental picture. So here I finalize the drug through the solid mental picture. First, it is a corrupted government servant. This picture I got it from my own experience. That person is a government servant. He visited my clinic 4 months back. He visited my clinic. He served some services. He provides some government services of some instrumental installation. I think he usually get the extra money from the people. Unofficially, he used to get the extra money from the people. So I have paid the extra money for his services, even though I have paid in governments, I have paid the fees. Here, with my observation, with my experience 4 months back, I have personally evidenced and experienced the corruption. So that's why I took it in that rubric side. Corrupted is a government servant, corrupted government servant. It is a psychotic rubric. Many people not willing to tell I am a corrupted person. Here, I personally evidenced with my observation of 4 months back. With my observation, I took it into rubric and feeling of persecuted. He is a continuous suffering, continuous bothering. He himself telling the state of I am bothered, tormented continuously with the suffering. The knife is a symptom. I got it from his wife. It is a innocent guy, easily believable guy. So I took the knife and sympathetic. He himself telling the symptom of sympathy to seeing the suffering person, poor humanity. While seeing that suffering person, I very feels very sympathetic. So I am just totally covering his mental state. A solid mental picture. I got the solid mental picture from a past experience and also present patient and bystanders. I am combined all the things. I just got the totality of mental picture. Now I took it into convert into the rubric. Here Here I already took the three rubric of pathology and sensation PQRS and sensation I just eliminated. Now I added his mental nature into the rubric. Here the corrupted person, so I took the deceitful, sly, corrupt venal and also feeling of delusion persecuted he is and also naive, sympathetic. I took the four rubric combined with three solid picture of pathology PQRS sensation. I got the remedy Chincona. Here we can find the three things, four things. China, Rastak is already tried. I tried, but it is a partial relief. Here it is a ruta. It is a important drug for tendon involvement and joint involvement, periosteal involvement. Here also a ruta is a important drug, but ruta. What is the feeling of ruta is a delusion is deceived. Here he deceives me. He get the extra money. He get the extra money. He's a corrupted guy. So it's a corruption. The ruta is a feeling of he himself feels the feeling of deceive. Here the China he deceives me. So that is my point of interpretation. So after taking that uh, 3 4 mental picture, I finalized the China. Just I have to confirm it in the mathematical side. In China, one more thing I forgot to tell that in at, in the tennis elbow, the chininum groups are involved. China and chininum self. That is a main important organ affinity. Organopathic affinity is very important. So here the China and chininum self involved. When go to the China and the Pathak. Materia medica, we can find the rubric, find the symptom of extremities, the pain in the limbs, joints as if sprain aggravated slightest touch amelioration from hard pressure. Here the same condition beginning itself, he mentioned that hard pressure ameliorate. At the same time, the slightest touch is aggravating. So just I confirm in Pathak Materia Medica. I confirm Pathak Materia Medica. So with the mental picture, combined with the pathology, PQRS and sensation. So I finalized the drug China Officinalis. I gave China Officinalis 0/1 to 0/5. Why here I choose the LM potency is the here the pain and suffering is continuous. So the patient need a continuous stimulation. So I gave 0/1 to 0/5, gradually increase the potency within the period of 3-month gap. The patient up to 0/3, he got relieved 50%. At the end of 0/5, 80 to 90%, he got better result in China Officinalis. That's all. So please subscribe my channel, and I am going to discuss my failures and success in this channel. So please don't forget to subscribe and press the bell button for time to time intimation. Whenever I am posting a new post, you will get the intimation through pressing the bell button. Thank you.